We have Dr. Allen on the phone, MD, from Urgent Care, from Dr. Urgent Care. Welcome to the show, Doc. We have our dear sister, Rita, who have a couple of questions. So why don't we start with those couple of questions, and then we can go right into what you've been doing for the community with regards to this COVID-19. Welcome to the show.
Thanks, Bishop.
So,
Hi,
Rita,
Dr. Allen.
How you doing?
I'm good, thank you.
I heard part of your concerns. I may ask you to repeat the question so I may be able to give you some enlightenment.
Mr. Bishop, what is my question?
well, Stevie has been working around someone, and they have been tested, and they were told in the city that they have a positive person that works in her department.
Okay. And have you had any symptoms?
No, I haven't had any symptoms.
Okay. So the CDC requirement is pretty much exposure to a employee or a coworker that has positive COVID-19 or coronavirus test. By itself is pretty much not the true criteria. It has to be a fever. However, I have had some leniency in those cases. I had a young lady to actually present herself to the urgent care with the same exact symptoms. She worked at a healthcare facility where a patient came in positive, and her coworker came in positive. She only had body aches when she came to me. She came to me with body aches. I then did a COVID-19 screening test, and she came back positive. And since then, she had 3 of her family members from the house that came in, and those individuals was negative. There have been cases, as I heard the last part of your conversation, where individuals have had no symptoms and has tested positive. What I've been fortunate to do is, if you have any exposure, whether or not you're symptomatic or not, I think you should at least go by and to a testing facility and get tested. Some of the funny things I want to say is, and I use this as an analogy, around Christmas, there's a lot of people that talks about they're going to do a toy drive. But one of my patients said, Dr. Allen, everybody's doing a toy drive, but they never tell us where to go get a toy. Everybody's talking about test, but as Bishop is bringing to the show, no one is telling you where to go get the test done. And I think that's where I come in, as I've established locations where you can go and have the same conversation, and if necessary, get tested.
Amen.
So, Dr. Allen, I have a question now. How long does it take, the test that you're doing, how long does it take to get the results?
We've been fortunate. We started off with LabCorp. LabCorp was the large entity that started the process, and everybody was using LabCorp. That's why the test actually was so scarce, if you can say, and so finding tests was an issue. Following that, and that test usually took 6 or 7 days. Following LabCorp, we entered into a new relationship with a new lab, and now the tests are taking at least 1 day, 24 hours. I'm able to get the results back, and I'm now trying to move even in another direction where I've found a company who can give us the results in 90 minutes. They've just received FDA approval, as I'm trying to become more efficient for the community. Early testing, early quarantine prevents the spread of disease. It's the individual that continues to go around without knowing, as you were speaking of, that continues to spread the disease.
Okay, and one more question. Now, what is the test like, Dr. Allen?
It's a simple test, and I would ask you, if you Google at Dr. Allen LA, again, Google at doctor, like at AOL.com or at gmail.com. If you Google at Dr. Allen, DRALLENLA, not only do I show you what the test is like, every day I show a person that comes to the clinic getting an example of being tested. And I also show an example of when I do get a person that's positive, as I've been fortunate to find 5 positive tests in the Los Angeles area. I show you what the results look like. So I encourage everyone to go to there. It'll show you what the test is like, the criteria reporting this to the CDC, the criteria reporting this to the Public Health Department, what happens after you come up positive, and it also talks about you can actually get the disease can pass in about 2 to 3 weeks, and you can run across another individual and get infected again. So I encourage everyone that I can to look at that site, and again, that's Google at Dr. Allen, DRALLENLA, and it gives you an everyday account of the saga that I say that we're dealing with out here on the front line regarding testing, regarding how we keep people quarantined in the car, regarding how to keep the environment safe. So if you do come to a tested environment, you don't have to worry about catching the illness from here, quarantining and isolation. Everything you need to know regarding COVID-19 testing out in the field on the front line is there. And I'm trying to do a good job every day of keeping people aware of what we're dealing with out here on the front line.
Okay, Dr. Allen, did you say you could get reinfected?
Absolutely, and that's what people don't know. And they don't know neither that the N5 that everyone is talking about, the KN95, is only good for 5 hours. And that when they talk about reusing these masks, it's only good for 5 hours. Antimicrobial component of it is only good for 5 hours. The KN99 mask is good for 3 weeks. There's a lot of misinformation that's not brought to the public's attention. And those are things that I address for those individuals who are fortunate to follow me at Dr. Allen LA, so they'll see what's really going on and get a real clue of what the front line is like. And they start talking about making masks, and they start talking about reusing masks. You go right into an unsafe environment where now your ability of getting exposed is as though it's the person that didn't have on a mask.
Okay, and one more question, Dr. Allen. I'm going to go to ask Dr. Allen LA, but I just got to know. Is the test with that nose swab?
Yes, it's a nasal swab. It's a nasal swab, absolutely.
All right, that's what I wanted to know.
Mm-hmm.
Now she's scared.
Yeah.
It's a painful situation, but it is a responsible thing to do if you really have one of the other symptoms. Doctor, can you please talk a little bit more about what CDC said, that you have to have the criteria in order for you to move to the test or write the prescription?
Early on in the outbreak of the illness, there was strict criteria for testing people who possibly have the COVID virus. And because of the lack of tests, we were very, very strict about who tests and who didn't test. But the FDA has stepped in, and now they're giving patents to individuals to move forward just to kind of produce enough tests for individuals to receive a test. But again, as I say, now becomes available to test, but then there's no one trying to test individuals because they themselves are afraid. The literature showed yesterday that a doctor out in Riverside tested positive for the COVID-19, and he infected 78 people that was coming through his clinic there. The idea now is if you have any potential symptoms and that can be associated or have been around someone, or even working in an environment where there's a lot of individuals in close contact, it may be in your best interest to get checked. Remember, early detection is the key here. I've been fortunate to test 5 people, and only one of them have, and to this day is in the ICU because of the coronavirus.
I'm not going to go home. Tell us what you came to tell us on this show. Enlighten us.
What I found is as the movement is going in the right direction, there are a couple of concerns I have. My first concern is the statements such as the test is free. I think that those things should be addressed in where are the free tests? Who's giving you the free test? Where's the funding for the free test? The second thing is, if the tests are free, then who's going to help the physicians or the providers who are scarce now, especially since the disease is spreading, and trying to keep them on board? Who's going to help with these expensive gowns, cap, masks, and paperwork that's needed? And so I think at this particular point in time, it's important that when we say or we address that things are free, that there's an outlet or resources to obtain those free things, so the public can then receive what's being said. It's difficult now to keep doctors from 70 to 100 and some bucks an hour to work, staff who don't want to come in unless you're paying them 20 bucks or more an hour to deal with the virus, and to buy these booties and hats that you have to throw away, and those things are expensive. And believe that these things are free, or actually to even believe that we have 60 to 90 days for the insurance to pay you when you have to keep some type of flow going on a repetitive basis in order to meet the needs of the community. I think now if there are resources available, that we should be able to tap into those resources immediately in order to keep the front line going. And when we make statements of things are said that tests are free, then the access to those free tests should be given, and what lab we're going to use for those free tests should be given, because the lab's not going to try to do it for free. So I'm not sure about those concerns, but on the front line, it's impossible when patients come in to say, "What I was told the test was free," to try to make sure you maintain integrity with them and say, well, how is it that we're going to keep the front line going when there is no funding that's coming in this direction? So that's one of my concerns. The second is the misawareness.
Let me put a pin right there. I think Bernie Sanders, you got a lot of people in this to freeze. And then our president and CDC and all of these other individuals have put this information out there. I know Dr. McKellar is back there smiling, but you're paying your pocket, your staff, your gowns and your masks and your things and the tests and all these things. You're doing this not only because you have one side, but now you set up 40 other sides that they can be tested. But I agree with you. When I did get on the phone, I did contact some of these officials that are out here, having press conference with the governor and saying, this is what we can do with this street. Because in this area, you are the only one that I know that is even doing tests in this area where we are, in this region of South Bay. And many of the emergency rooms, they're doing pre-tests just if you have a fever. If you do, they turn you away. Now, we just got the motion shipped to Los Angeles, and I think it's 1,000 people. It doesn't make the Mississippi. And they got a $2 trillion bill passed and signed by the President of the United States. But I don't see any of that money. And I know that you don't see any of that money. And I applaud you for what you're doing. But you're right. That is something that we really need to address. And Dr. Keller, I don't know what they're doing in Texas, but I can tell you in California, you drive around in some of the streets and some of the communities, and you will find that these people are taking this as a holiday, and they're testing, their family members, their friends, their people. And it's a shame because we're talking about the peak in 2 weeks. The peak in 2 weeks is going to come from these people staying out, getting infecting all those people that stay in when they go in. So, Doc, tell me what we can do to help you help us.
I think right now there's a couple of things that would make sense, and my words don't actually get to political powers. There are a few things that make sense. One is if individuals themselves paid or at any source paid for their test, that they should at least be able to deduct that from their taxes, since we're making them have insurance, as a way to make sure that the people now stop believing or counting on government to save them and step forward. I think if you are out waiting or perceiving that there's going to be something free, you're just putting yourself at risk. The longer you wait, if you have symptoms, assuming that there's going to be something shipped to your house, or that they're going to be a creation of some type of area. I think if that was going to happen, they'd already had the public health or department or some actual location where all of us will be able to go there and get tested and move forward. No one is stepping out in the administrative line and even giving you a place to go get tested. They're just saying we're going to send out all these tests and all these domes. But everybody's saying that we need tests, as I said, with my Christmas analogy, but they're not telling you where to go get tests. And for the guys like myself who are doing testing, we can't afford to wait 60 or 90 days for your insurance to pay us when all this equipment, all this stuff that we need to function out here, including the tents, are expensive and to survive. So one of the key things is if you're sick, then move forward. I'm not saying that administration, those individuals aren't trying to do what's right. I think these guys have a heart and they don't want to see the country suffer. But I do know that if you are sick and politics takes a little longer, then you should go get tested and figure out later what are they going to do, or where the finance is going to come. That may not come until July, August, because it takes this person to sign and that person to sign, and by the time we get into funding, it's going to be a line of people that have their own vested interests that may not be out here on the front line, that they're not out there swabbing noses, as the young lady has said, or they're not out here with gown and mask and hoping that them and the staff don't get ill behind the illness as the death rate increases and the number of infection increases. I think if there may be, I'm sure, I hope God has blessed us that there are more individuals like myself that's on the front line that's saying, we're here, we're going to test, we're going to work with whatever parameters we have. If God blesses us to get funding, we will. But if not, we're going to keep moving. And if you don't have access to testing, we will. And we're going to be here for you. I think about the time that someone actually comes to the front line, the front line, and when I say front line, I'm going to say the small front line, if you will. I don't have the namesake that Kaiser has, or not to say anyone bad, or Cedars or whoever. I don't have that power, and so what's going to happen? Those individuals who are sitting closer to the mayor or to the president, they're going to get the money first. They're going to feed themselves and their establishment, and the individuals like myself, and I thank Bishop for bringing it to their attention, are going to be the last person. I don't know you exist. You don't have a name. But as I do put up numbers, single-handedly, I put up 5 cases in Los Angeles. Now, that's more than UCI. And at this particular point, I'm more than Martin Luther King Hospital out here in L.A. And that's one individual. As I continue to stand, and when I say put up numbers, that means I've tested and confirmed 5, now 6 positive coronavirus individuals in Los Angeles. And that's single-handedly. What main reason I expanded, if I increase my area, I can probably be more effective with making the numbers better in terms of having the availability to treat, as you say, this neighborhood. Public Health now are sending people to the clinic. Blue Cross Blue Shield are sending people to the clinic. The community themselves have recognized that you are here, and they themselves are spreading the word. Go to Dr. Allen if you're getting tested. maybe at some point this message will get back to a person that has the ability to say, well, okay, let's if at minimum if we can't do anything, let's bring some those space suits, as the patients say, to the rescues. Those things are going for $25 to $50 each. The goggles are going for at least 15 or higher. The hair bonnets are going for $7. The booties that we put on our shoes are going for $3. And so that's just it. To actually put on an outfit and test a person can run you anywhere from $45 to $60 just to dress up and go in there and deal with the virus. That's just that part, and not counting the physicians, and then where we're going to go or what we use for the lab. So I don't know if there's going to be any true help soon. I think there's going to be a lot of talk before, but that my main focus, irrespective of that, would say, as the lady in this case, irrespective of that, save yourselves. Come and get checked if you need to, and don't wait for someone to do something for you. Because if by the time that happens, that you may have the disease, and it can be deadly to some people.
Dr. Allen, we have a picture. Dr. Allen, just 1 second, and then I'm going to turn over to that. Dr. Allen, I'm looking at a picture that I posted on Facebook. They have a picture of the physicians that are dealing with patients in China, Korea, and England. And then I look at the picture of the American doctor yourself. The hazmat uniform that they have, and the face gear and the gloves are totally different from what we have. Why is that?
Because they have the exact real material that's needed. And if you really want to see, you want to look at where the origination of the virus started, which is the Chinese culture. These individuals have been exposed enough to this disease to know exactly what to wear and dress and protect themselves to prevent the spread. Because it's new to us, we haven't really figured it out. And if we looked at what they have, we would definitely have copied it immediately. But since it's new to us, we're using our same old techniques, where these individuals have had this disease, and it has spread rapidly, and they have not actually cured it. But if you take the uniforms or the outfits, or in this case the gear or wear that the Chinese are using, that is what stops the spread. And that's that goggles, face mask, hoodie, bunny, a N95 and an N99. They have two masks they're wearing. They wear two sets of gloves. They wear their actual scrubs, and they wear this space suit on top. And then they have the booties that comes up like boots, like rain boots, up to their knee. And then they almost like a respirator type mask that they have when they go in the room, and they have their eyes covered. So, and when they go in, they see the patients, and they come out and they throw the gear away, making sure they don't recontaminate themselves by using it. They have these videos on that tell you the proper gear for staff when they're dealing with the coronavirus. Here, because we don't have anything, you see us with some type of gown to protect ourselves, maybe some goggles or gloves to make sure that no sputum or secretions gets into your face. And gloves. We're not properly armored. Now the reason is it may protect you in that environment, but now you walk around and you still got your clothes on, or you're not properly covered. Now you can infect people within the clinic, there's a paramedic unit just passed by, or you could affect people at your home. So they wear exactly what's needed, because they've had enough experience with the disease to let you know how serious it is. We're still in the it's okay, it's not going to bother me stage until the numbers hit so high. I'm in an area where there's a lot of activity.
Dr. McKellar, I know you had a couple questions. Go ahead.
Yes. First of all, sir, I want to say happy Doctor's Day, and we appreciate you and the nurses and all the medical workers for all the great work that you're doing there at the front line. I actually serve on the task force, the COVID-19 task force here, and it's composed of the health department, the city, the county, all of the ISPs that are in our area, and we put actually funds together. I'm so proud of East Texas, this county, Tyler, Texas, where I live, for how they organized our task force, and we're on the phone every morning, every day, from 9 until 12, keeping up with the data, keeping up with the changes, keeping up. We actually have the plastic shields that you're speaking about, but we're so short on supplies, and my task has been to find more supplies, and we've been able to do that. But you're absolutely correct in the fact that we're not handling this like it should be now. People are off the street here in Tyler, Texas, because Friday they said we got to shut it down, and the only way that we can get that bell curve to flatten out is that we have to keep people at home. And that is the one thing that I see that people were not taking seriously at first. And so I thank you for all the great work that you're doing there in the Compton, Los Angeles area. We need more of you out there on that battlefield that's working. We have the medical society, we have the nurses society, we have the colleges. We actually, now that our hospitals are filled, we're using our colleges because nobody's there. We're setting those up as dorms. I'm speaking as a hospital. The dormitories are used as hospitals, and then our National Guard was activated today. They're not deployed yet, but we took one of our closed schools, and that school is going to be the headquarters and the housing for our National Guard once we're activated. So we have a really, really organized task force that's really got a handle on what is going on in our area.
Thank you for the comment. Sometimes just a little appreciation is all we need out here.
Absolutely appreciate it. I'm part of the medical profession. I understand fully. I'm a retired clinical nurse specialist from the military, so I have great compassion for what you're going through every single day out there on that front line. I hear about the stories every day. I hear from the people that are in our hospitals here, and how they're screaming for supplies and screaming for more test kits. So thank you so much for that. And sorry to have to say, Dr.
I wanted to ask a question. The 29 doctors that died working with patients in the front line and other places. Dr. McKellar, for you too. What do you think was needed after we deal with this, after we battle with this, that we never have to deal with this like this again? The unpreparedness. Dr. Allen, you first.
Can you? It was kind of. I didn't quite get the question. Can you read?
29 doctors have died since the corona virus has hit. And I'm asking, after we battle this and we win, what do you think we should do to ensure that this never happens again, where we have doctors on the front lines and nurses on the front line dying because there's the lack of preparedness? Today, the governor said that we received 170 broken ventilators from the President of the United States.
I think it's just like in any battle. When you go to war, you didn't know what the other team had, and you didn't practice. This one was a warfare where there's no real physical individual to bomb, fight, or shoot. And because we didn't expect it to be in this viral form, it took over. Now, mind you, we should have had some clues from the swine flu. That was the bird flu. We've had multiple entities where there have been similar incidents. Exactly right. And we should have had a readiness package like we do for an alert for any sort. I think being mentally invincible was our fault. Now here is why I say that. We had plenty of time to prepare. We saw China dealing with this, but we didn't prepare. We saw Italy and Europe dealing with this, and we didn't prepare. So we can't say, oh, now we're going to do something that is us. We had enough time to say, okay, let's orchestrate, and so when it comes here, we're ready. I just think we're just too overconfident that no one can touch, or no entity or power or whatever can create chaos in United States that some people are still in denial that it's going on. They still want their life to be normal. They still run around like there's no curfew, or don't understand why the freeway is closed down, or why they can't go to the bank and they're still in denial because we get a perception that we're invincible. But I think the reality is when we come back to the table, and we either deal with this leadership or new leadership, when it comes to protecting the people, I think the biggest lesson here is going to be, once any attack happened, we must go inside and prepare no matter what. We could have made our own N95s. We could have made our own ventilator. We had enough time before it hit America, so we weren't, asking tremendously for someone to help us, or if you watch the bidding wars where the ventilators here is so much, and then New York's asking. So now the guy's saying, well, if you're paying this much, then I want this much from California. We wouldn't be caught in this time of running like we're scared and not knowing what to do, when clearly we saw this coming. I think preparation, first of all, taking a big beating, which is what we're doing, is going to make the survivors understand that we can't do this next time. Any warning will bring about the people in power, or our voted officials to start working from their angle. So the smaller people, the 9-to-5 guy, or the guy that cuts the lawn, he won't have to deal with this. The administration or people in power will have already put systems together where we would know what to do and how to respond. Even if it got to this level, it'd have been so much calm and confidence of where to go, fallout, housing, shelter, food, elderly, gasoline, essentials, non-essential, working place. It'd have been so orchestrated like a safety drill that we would have just went right into what we know to do, and we just stayed there until it passed.
That's great. Bishop, I want to jump in on that as well. And thanks, Doc. You're absolutely correct when you said drill. It reminded me of the military. We trained every single day for war, even though it took a long time before I ended up going to war. So we're going to have to handle this just like we handle fire drills, tornado drills. We got to be trained up for this. Webinars, both Doc, you have to do your CEUs, I have to do my CEUs. So we have to have continuous education on this, so that whenever this happens to us again, because this is not new, we've had SARS to hit us before, as you know. And so we just have to be prepared for this once it happens again, because this is going to be our new normal, would you say, Doc? So that's how I look at it. We got to be trained up, whether it's webinars, however we get our CEUs, our fire drills, our tornado drills. We're going to have corona-type drills so that we can be prepared, and we'll have the equipment down the line. Thank you.
Well, I would like to make sure that our representatives know we're going to take them bringing partisan arguments into a emergency situation. I feel like they have grossly neglected their duties. I'm sorry. Also, Dr. McKellar, we were talking a little bit about the states barring people from going from one state to another. Did you all get a memorandum saying that if you were in one state and that state is infected, there's a quarantine period before you can be released into another state?
Exactly. In particularly, especially Louisiana, because of the fact that they went ahead and had the Mardi Gras, and they have a large number of affected people there, and they're trying to leave out of Louisiana and come into Texas. And so if they can come, they're tested. If they're not positive, then they put them in quarantine for 14 days, and they're allowed here. But if they are positive, because of the fact that we have, and this is, I'm only talking about my city, we don't have any space to accommodate more sick people, because we don't actually have space to accommodate the sick residents that are already here. That's why we're having to work towards using the colleges and the closed schools to set up hospitals. We have special hospitals that's going to be for special needs people who have the corona, and then we have a special hospital, a special facility that we're using for medical personnel who become sick, and then we have to find a child care areas for the medical people. So we just didn't have the space to take care of, medically take care of people from outside, from Louisiana. That's really the state is Louisiana. So if they come and they're not tested positive, then, or not running a temperature, then they are in quarantine for 14 days and they can be here. Otherwise, the others that are positive, they have to go back to Louisiana.
Doctor, do you want to say anything before we close out?
I just want to bring and I just, if anyone is having symptoms at any point, or they believe that they've been exposed, early detection. If you have any symptoms, please get checked. And if so, then now we can deal with isolation and prevention and stopping the illness. If we get to a point now where you are sick, and you'll see, if you see any of the videos I have, now you are sick, by the time you find out you have symptoms, you probably have infected a lot of other individuals. So my only, you won't be able to beat this illness other than detection and finding some type of quarantine is what we're talking about, because it's self-limited. But the faster you can find out if you've been exposed, and you can get away from others and not continue the exposure, or put yourself up if you have tested and then you negative and you get back in this environment and get the infection again, because you can actually get tested and then and now you don't have the illness anymore, but you can reconnect, you can get back in society and get it again. If you have been exposed, get tested, and at that point we can kind of pull you away from everyone else. They talk about the peak of the illness. That's subject to question, because there's areas where when we start talking about the homeless or the indigenous, who we couldn't put block out or self quarantine, that still would be out there. We don't know when this peak is going to happen, but if you do have any exposure, potential exposure, get tested. Early detection, if I can say anything on the show, is the key for slowing down the spread, and then taking those individuals and then isolating them where we won't continue to allow the perpetuation of this disease.
That's right. Thank you so much, Dr. Allen.
Thank you too.
Yes, sir.
Okay, Doc. We appreciate having you on the show, Dr. McKellar. We appreciate you, the work that you're doing as well. Ron, thank you very much. And I'm real excited to say that we at least got another show. I think we can include a lot of people.
Thank you, Bishop, for having me on the show.
God bless you. Thanks for being. Yes.
Good night.
Really?
Good night, guys.
Good night.